what to expect at your Ortho-K consultation. Hey, it's Dr. Play again. So, you may have found out that you're a candidate for orthokeratology for yourself or your child. Well, what can you expect at your next visit? This video will go over what you can see at the eye doctor, and from my perspective, what we want to collect. So, one of the instruments you might encounter is something called a retinoscope, which looks like this, or an autorefractor, which looks like that. What these instruments do is basically tell the type of refractive error you or your child have. So if you have myopia, if you have hyperopia, if you have astigmatism, all these things that are medical terms for farsightedness or nearsightedness. This doesn't give you the exact glasses prescription, but it gives the doctor an idea of the type of refractive error they'll be dealing with. Another instrument you're going to encounter is something called a corneal topography, which looks like that. Corneal topography measures the shape of the front surface of the eye. Now, this test is very important for orthokeratology. It helps rule out if there's any corneal pathologies or diseases that would make you not a candidate for orthokeratology. It also helps the doctor design the Ortho-K lenses themselves, especially if they're using a custom Ortho-K design like we use in our clinic. So corneal topography, definitely very important in that initial consultation. Then they'll do something called a manifest refraction using an instrument called a phoropter. And there's manual phoropters that look like this, or if in a more modern clinic, a automated phoropter or a digital phoropter that looks like that. Now, both these instruments are doing similar things. They're measuring the refractive error of your particular prescription. So the amount of myopia, the amount of hyperopia, the amount of astigmatism, this is basically measuring the glasses prescription. And this will tell the doctor if you're indeed a candidate based on the amount of your glasses prescription. They'll also do something called a biomicroscopy exam or a slit lamp examination. And the slit lamp looks like this. So this is the microscope that we actually use in the clinic to make sure that there's no diseases on the front surface of the eye, checking for dry eye, basically overall health of the front eye. So these are some of the common things that you can expect at an initial Ortho-K consultation. You'll have a retinoscopy or autorefractor, which is done, which again looks like these two instruments. You'll also have a corneal topography done, which looks like that. And then also a manifest refraction using a phoropter, which looks like these two guys right here. So I hope that helps in what you can expect at an initial Ortho-K consultation. If you have any questions, please let us know. Drop them in the comments. Talk to you soon.